In our morning rounds, would you ever choose to stay awake during surgery? Some specialty doctors offer patients the opportunity to have local nerve blocks instead of general anesthesia. For example, this may happen in orthopedic, breast, colon, eye, and cosmetic procedures, but not every patient may be suited to this option. For Exhibit A, our Dr. David Agus is in Los Angeles. Hey, Dr. David Agus, I saw this on an episode of Grey's Anatomy. The patient was strumming the guitar and everything. I thought, that's a TV show. Why would anybody want to do this?
Well, in the case of Grey's Anatomy, when there's a tumor in the brain, you don't know exactly where the motor section is of the brain, the speech section, and the doctor does that so they can avoid cutting things that are important. But there's a new movement growing around the country. That is people saying, I want to be in charge. I want to be there when the operation happens. And at the same time, they're also saying, I'm afraid, what if I don't wake up from anesthesia? It's cheaper, there are less side effects, and this is a trend that's starting to happen, is that people be involved in their own surgeries.
Is it better for the doctors?
I think it's difficult for the doctors. We're not trained in medical school to have a 2-3 hour conversation with a patient during a procedure. And, you got to watch what you say. And if you're going to have trainees there, sometimes the patient doesn't want the trainees. And there's those interactions that are sometimes difficult to have when the patient's awake. At the same time, it's a movement that we have to respect that patients want.
But is it painful? Are they cutting on you when you're awake? That's what I can't get over.
Well, it's a nerve block.
It's a nerve.
So
okay.
You're blocking.
Okay.
If you put a regional block here, you're not going to feel anything down.
Okay.
Or in the hip, they could do it. Put a block, in your hip
like
area.
Like when you have a baby.
And operating your knee.
A
cesarean section is a great example where they can actually do a spinal block, and you don't have to put a general anesthesia.
You also get a chance to see what doctors talk about during an operation.
Or what music they like. I mean, the doctor's musical taste may not be your own.
Hey, how does everything look down there, doctor?
But there are some distinct advantages, Dr. David Agus?
No question about it. It's cheaper. You can go home quicker. If you have operation on your hand, with a regional, you can go home an hour or two later versus waiting a half a day for the general anesthesia to wear off and having somebody else drive you home. You could drive home yourself after this regional. So there's no question that the data are showing that it may be better to do it this way.
And who would be a good candidate for this?
Knee operations, extremity operations, we're getting more and more. Colonoscopy. Some people say, the doctor showed me my polyp during the colonoscopy. So it's a trend that's happening, and it's something to discuss with your doctor if you're going to have surgery.
And what happens if the patient gets agitated or very frightened on the table and has what they call a freak out? The technical term for that.
So if they have a Gayle event, what happens is there's an anesthesia always there. An anesthesiologist is always there, and a patient can be put under, and they're warned of that in advance. If you get too stressed or there's a turn in the operation, I may have to put you under. So the key is that communication prior to the surgery so the patient knows what to expect and what can happen.
Wow. It's a really interesting topic.
I think so, too.
It's a brilliant, thank you.
Medicine is changing.
Yeah. Always great to talk to you. Thanks so much, Dr. David Agus.
Thank you.